Welcome to another episode of Crawfordsville Connection, the City of Crawfordsville's weekly podcast that comes out every Monday morning. I'm your host, Sarah Summer, and I'm joined in the studio every week with Mayor Todd Barton to keep our community up to date on current events, city workings, and to hear from community members on a variety of topics. Thank you so much for joining us, and we hope you enjoyed the show. Welcome back to another episode of Crawfordsville Connection. I'm your host, Sarah Summer, and today I'm joined in the studio by Mayor Todd Barton.
Hello.
Hello. We have a full house today.
We do have a full house. That's good.
Yes, it's been a little while since we've had everybody in here.
I'll talk less.
Okay.
Not like a general update.
Yes. This isn't the mayor show?
No,
not this one.
Not this one.
All right. Well, we have a group with us to talk about drowning prevention and water safety. But before we start with that, I will go over some announcements. We have the city offices closed on December 24th, December 25th, and December 26th for the Christmas holiday, which impacts our trash pickup. So we will have double pickup on Friday the 27th, Monday the 30th, and Tuesday the 31st. So we will detail out who's getting double picked up when on our social media. So if you've got questions, refer back to the city's social media page. And then as a little early reminder, since they back to back, the city offices will also be closed on New Year's Day, January 1st, and we will have no trash pickup on that day. And there will be a double pickup on Thursday, the 2nd.
Confusing.
It is confusing when we've got the holidays back to back. We're closed and, the weekend in there. And
well, it falls in the middle of the week this year, so it's made it challenging.
A little bit crazy, but we've
But
confirmed.
we will get your trash at some point.
Yes, don't
Guaranteed.
worry.
Yes.
Okay, well, we will jump right in and start off with introductions. Today we have Fawn Johnson, Samantha Mitchell, and Paul Miller with us.
Hello.
Fawn, if you want to start off and tell us a little bit about who you are and why you're here talking about this topic.
Good morning. I am Fawn Johnson, the Director of Parks and Recreation, and I am here as part of a coalition aimed at increasing water safety and drowning prevention within Montgomery County.
Awesome. Samantha.
Hello, I'm Samantha Mitchell, and I am the Director of Mobile Integrated Health here in Crawfordsville, and I also sit on this local coalition.
And I am Paul Miller. I'm the Deputy Chief at the Crawfordsville Fire Department, doing the same thing.
Awesome. So this coalition is the Montgomery County Water and Safety Coalition. Do you want to give a brief organization overview and talk a little bit about why this is important to our community?
Yeah, so drownings and water safety as a whole, big concern for the fire department. It's a very challenging thing that our firefighter paramedics have to deal with. It's stressful, and we want to get ahead of it. We've faced many issues with water safety issues in Montgomery County. We want to do a better job of increasing preparedness, especially with the elementary kids, ages 4th grade and below. And this coalition allows us to partner, as we've done so well here in Montgomery County for years. We've been very successful in getting grants because of leadership in so many different offices. And this just brings us together to do a better job for everyone that lives here, bringing together the local health department, the aquatics center, and the parks and rec department. All of us have a vested interest in kids' safety and water safety in Montgomery County.
Absolutely. Mayor, Paul touched on this. This organization is all about community collaboration, and that's something we highlight our community does really well.
Yeah, definitely. I mean, we're pulling together all these different entities because we don't want to see another drowning.
Right.
It's tragic for the families. It's tragic for everybody involved, and it has a profound impact on our responders who have to respond. So we're trying to get ahead of this and be proactive. And when you pull together these kinds of groups, it's very powerful.
Absolutely.
I can say 3 of us in the room have each had to deal with this as a responder. Fawn Johnson's been a lifeguard for a number of years, leading the parks and overseeing the lifeguards, the mayor, firefighter, paramedic for a long time myself.
Yeah.
This is probably, we've been very successful in receiving funding in a lot of different areas, mobile integrated health, fire department, parks department, city as a whole. This is the one I'm most excited about being a part of. And it's not a lot of money. It's a lot of money to do what we're doing and really highlight, I think, stand us up as a premier organization and city in the entire state, nobody's going to be doing what some of our goals are in addressing this in a community our size. But the amount of time between seeing the grant posted, we had 3 days to pull this together.
Wow.
And for the aquatic center, the health department, mobile integrated health, the mayor to allow us and Fawn signing on to participate, and not all of us being 100% on the same page of what we were looking at doing and addressing, write the
Right.
grant, get it submitted, and then hold our first meeting a month later. It's been a lot. And the communication between all the organizations, we've already had 3 meetings, ongoing email chains. Everyone is fired up and looking forward to the start of the year to really build this out.
Absolutely. You know, for somebody who might not know, when you talk about water safety, what does that entail? And, you know, do you have some stories or statistics of, you know, why water safety is so important?
I don't have the statistics right in front of me. Some of the ones that stand out to me is Fawn shared with me off the top of her head. I think her lifeguards at the city pool made 16 saves
Wow.
in one summer. Our department had responded on nearly
6 within the last 7 years.
6 within
Mhm.
Drownings.
the last 7 years. So we're
Wow.
looking. You know, we have water retention ponds, home pools, the city and county parks pools, rivers, creeks. I mean, there's a lot to address there and a lot that we respond on. So if we can prepare everyone better, making sure kids in the elementary schools have access to swim lessons,
Yeah.
making sure that they're safe. A lot of community awareness with hands-only CPR. There's a lot we can do on the prevention side to make our communities safer.
Absolutely. And the grant you mentioned is from the Indiana Department of Health. Do you want to share how much money you were awarded and how you know, what did you put into the grant to be awarded for this?
Sammy, you want to touch on a little bit of?
Sure. So we were awarded $18,000 for 2025. And we're looking at breaking down funding for lifeguard, water safety instructor training for 2 local individuals through our local health department to be able to teach
Mhm.
training. Because right now we have very limited
Yeah,
instructors.
The local options are, if you can take it at your school, you've got that as an option. But if you want to become a lifeguard, there really aren't options for people without leaving town to get that
Okay.
training. So one of the things we wanted to do was get some local individuals trained. So we're increasing access to those classes for young people wanting to become lifeguards.
Yeah,
It's
absolutely.
a huge commitment.
It
It's
is
a
a time
lot of training.
commitment and it's a financial commitment. So that's
Right.
part of what we can subsidize with these grant funds.
So one of our early goals is to get that accomplished within the first quarter of 2025, and then we'd be able to promote
Mhm.
lifeguarding training for both students and really general population, anybody
Yeah,
that wants
anybody.
to get that training. And that would include, you know, CPR, stop the bleed, a well-rounded training. And then we plan to do a media campaign throughout 2025. And that's where we will work closely with our local health department, looking at the state health department and what already exists. And we'll just enhance on that. And so more to come with just media post. And then one of the big things that we were wanting to do through our department as well is offer safe tubs and
Mhm.
infant baths. We have a program called Project Swaddle that works with high-risk moms and babies, and we've just been able to expand that through the Community Foundation to work with moms to up to age 3 with their children.
Right.
So there will be a focus on drowning prevention, and in those programs, our local health department also offers a diaper pantry for individuals in need. So they will make sure that there's access through that programming too.
Yeah, it's a lot.
Did I
And
miss
then-
anything? It is a lot.
One of the other things that I can think of is vouchers for swimming lessons.
Yes.
We offer lessons through Parks and Recreation, and the demand always exceeds what we are able to accommodate. So one thing is getting more people trained to teach those classes, and then subsidizing the cost of that for people that maybe can't afford to pay for the full price of those lessons.
Yeah, I think it goes unrecognized what our aquatic center does for the community too. Kevin Hedrick and Sarah Dowd doing all the elementary education.
Mm-hmm.
We're very lucky to have access to a top-notch pool. I mean, one of the top in the state, and then the instructors to be able to provide that education for our kids to make sure they can at least self-rescue
Right.
in dangerous situations and learn those basics. Probably goes right along with the Sugar Creek Swim Club and the success Crawfordsville High School swim teams had over the years of having that early access to education. So we want the whole county to have that same access. I think the only hurdle in our first month that we encountered came last week. So if you've been to the Indianapolis airport, seen a CPR mannequin that you can try out and see if you're doing the proper depth and rate and all that, because CPR is very exhausting. It's a very hard thing to do, especially if you've never done it and trained. And we want to build that awareness campaign to doing hands-only CPR. But I reached out to the American Heart Association to get us access through this grant. Turns out it was a little higher than that $18,000 that I anticipated.
It's a little bit higher.
It came in at about $400,000 for a 3-year sponsorship, and we'll have to come up with alternative methods for our fire instructors and the new instructors that Adrienne Northcutt's going to train through her local health department.
We thought we could put that trainer in the high schools, and just like you see at the airport. But it was a little out of our budget.
Just a few more dollars.
Yeah.
Be the next grant.
Yes. Well, thinking through some of this, it does take, all of these different organizations, like you said. And, as first responders, you are responding to some of these, incidents. But Fawn, how do you think having, water safety in our community will impact you at the Parks and Rec and, giving a peace of mind, I guess, for when people are coming to visit pools?
Well, I think that it definitely applies to pools. Obviously, if kids have access to swimming lessons, they're going to be safer. It's always good to be swimming at a place where you have lifeguards that are supervising. Part of this is ensuring that we are appropriately staffed so that we have the resource of lifeguards available to us locally. There have been national shortages of lifeguards since COVID. Luckily, we've been able to stay well staffed. But there are, like I said, barriers to that access locally. But along with that is, the precautions that people need to take outside of a guarded swimming pool. So understanding the power of the water if you're visiting Sugar Creek, making sure that you're not swimming anywhere alone. The education for people that have backyard pools in terms of what are the safety precautions they need to take. Maybe it's just understanding that your child maybe needs to be wearing a life jacket when they're in and around water, whether it's a swimming pool or an open water setting. So it's education, it's access to swimming lesson, lifeguarding classes, just kind of an overreaching kind of approach to this, as well as, like Paul said, something as basic as compression-only CPR, making sure that more and more people understand those skills and are ready in an emergency situation.
Yeah, it can help alleviate the situation before first responders can get there. If there are more people in the community that are able and willing to step up and help out, that can help save a life.
Yeah, that time is critical between when you recognize an emergency, providing care in the few minutes it takes EMS to arrive. That's the difference between someone living and dying.
Absolutely.
Being in the early stages right now, too, we're hoping we can get more support and more interest. So we have subject matter experts in certain areas, and we're looking to grow the coalition as we continue this. This won't just be the period of our grant for 1 year only. I think this is something that's here to stay, and we'll continue to grow and get better and bring on more and more resources and community partners.
How do you see the community joining in to help out, or, who can they reach out to if they are interested in, supporting your efforts?
So I think right now, one of our long-term goals would be bringing on community in the county schools, in the elementary schools. How can we provide the education to those kids, 4th grade and below, whether it be through maybe the Waytown pool or coming in the city in the summertime and months with the city parks department. That would be one area that we look to expand and grow, going on the success Kevin Hedricks had at the Aquatic Center. Bring in early recognition into water safety through the diaper pantry and Project Swaddle with mobile integrated health,
Mhm.
touching them, providing them with resources. And then we don't know what we don't know.
Yeah. I think another initiative that we're planning on reaching out to is the early childhood expansion through the community foundation, since they're touching on all the daycares and getting them up to speed. But really anybody can join. So if somebody is just interested in this, please reach out, and they can reach out to any of us. Our information. Adrian through the health department. So city website, our Facebook pages, where our information is out there.
Okay, awesome. So if people, are listening to this and they're interested in, like, hey, I want to become a lifeguard, or I know someone who could become a lifeguard, when do you foresee some of those programs being ready, whether that's the swim vouchers, the baby baths, any of these things? When can people anticipate this stuff being ready?
The swim lessons, so right now that's going to be through the Crawfordsville High School starting this first semester in January, or second semester in January for Crawfordsville High School students. Once we get our new lifeguards trained, probably by April, we look at doing a community open one for the summer, probably starting in May. The tubs will start to become available the 1st of January through the health department and mobile integrated health. Hands-only CPR, we're going to probably start some campaigns here in January. We'll start posting the resources in January, how people can get involved. I mean, they're open meetings. We're not having closed-door meetings, looking to share and expand.
Okay. So there's a lot to look forward to, and this will be, the social media pages. I will tag all of you in the show notes so people can look for those different social media pages to stay in tune with different things, and making sure that they're up to date with things. And I'm sure, as things get rolling, we can do an updated episode too with more information detailing the success of the program, how things are going, and other ways that people can continue to get involved. Is there anything else that you all would like to add? This seems like a really great program, especially pulling so many different organizations together, getting the grant to get this started. And it's really only the beginning for what could be really impactful for our community. Anything else to add, Mayor?
No, nothing else.
Awesome. Well, thank you all so much for being here. We appreciate you and your efforts for supporting our community in this way. And as always, if people are listening and have topics that they would like to hear about, please reach out and let us know. And don't forget about Yodel, our Community Connections calendar and newsfeed with all things happening in Crawfordsville in one easy and convenient location. And we thank you for listening, and we'll see you next week. Make sure you hit the subscribe button on this podcast so you never miss an episode. And if you aren't already, follow us on Facebook at City of Crawfordsville Official, on Twitter at City of Seaville, and on Instagram at City of Crawfordsville. We hope you have a wonderful day and can't wait for you to join us next week.